Thank you for having me on the program. Delighted to be here. First of all, just to make a very clear distinction between malaria eradication and malaria elimination. So your question about eradication is actually talking about eliminating the parasite population from the entire continent. On the other hand, elimination refers to eliminating malaria and the parasite from specific geographical regions. So with that unpacking of the distinction between eradication and elimination is that some of the major challenges that we have towards the ultimate goal of eradicating malaria are, first of all, from a medicine perspective, it is the use of fake medications. This is a major problem where people are using and promoting fake medicines that obviously are just gonna exacerbate resistance, and that's a huge problem in the continent. The second challenge is, again from a medicine perspective, is compliance, and because most of the communities that are affected by malaria are very poor people. And so often, because of a lack of education in terms of understanding that when you have a malaria medication prescribed to you and you are asked to take that for 4 days or whatever duration that the clinician tells you, that when you feel okay after 1 or 2 days, you mustn't stop. You must carry on. And what often happens for understandable reasons in these communities is that they will save on the pills or the capsules or the tablets when they feel okay, so that they can use them again because they can't afford. So again, that's a major problem. This is really socioeconomic issues that are really compounding the situation where people are not completing medication. Another two things, I mean, I can give you a very long list, but just another two really are also to do with the fact that when you think about it, prevention is always better than cure. And so even before we think about medicines, it's about, clean water, people using mosquito nets. And again, because of poverty in these communities, some of these bed nets that are used, are supposed to be used for, preventing mosquito bites. They are used in fishing, for example. This is not something that one should actually think is a joke. It really is a reality. And because people are poor. And so, so again, if we don't address socioeconomic issues, we're not going to help with malaria eradication. So I would say those are the things that I would highlight. And maybe finally, as a political factor, is this instability, where instability, conflict, in different nations allow people to cross borders and of course, move the parasites across borders, the borders become porous, and malaria becomes difficult to control. So I would say, first of all, that even if we had a vaccine for malaria available, and I think COVID-19, the current pandemic that has affected the entire world, I think has reminded us that it is not just one intervention. We're always going to require multiple interventions, because even if we had a vaccine for malaria today, the effectiveness of that vaccine may vary from population to population. So I think we're gonna have to think about multiple interventions. We've seen this in other areas as well, where a vaccine is developed successfully. After a number of years, the efficacy of that vaccine, gets compromised. So even if we had one available, we'll still need other interventions, including medicines. So some of the ones that are being used in Africa, certainly the artemisinin combination therapy regimen is very much in use in Africa. And of course, there are other medications that are also used around the pyrimethamine, sulfadoxine, and again, it just depends on which geographical area that you are, because even in some areas of Africa, chloroquine is used. We had this story of where chloroquine was withdrawn from certain parts of Africa. I think Malawi was one example. because of resistance that rendered chloroquine useless, and malaria impossible to treat in those areas. But we saw what happened when the drug was withdrawn. After a number of years, they could reuse chloroquine in some of those areas. So we have different drug regimens that are actually used in different geographical areas of Africa, because the parasite species and the prevalence varies across the continent. And so it's not uniform, it's not homogeneous. And that's why we have different arsenals of drug regimens being used, including, of course, the artemisinin combination therapy regimen. Yeah, so what are the medicines that are in development? And I would like to just give an example, a couple of examples of very promising molecules that are in clinical development, developed by Novartis, who once upon a time, the Novartis Institute of Tropical Diseases, NITD, was based in Singapore. And they have come up with a couple of new drugs that are in advanced clinical development. One class is called the spiroindolins, for example, that work by a mechanism that is novel, that the parasite has never seen before. And what we are looking for in the next generation of medicines for malaria is really medicines or drugs that are able to kill the parasite at multiple stages, including killing the parasite at the liver stage, therefore offer protection or chemoprotection, because then we don't see symptoms of the disease when the parasites are in the liver. Then, of course, we're looking for drugs that kill the parasites when they're in the blood, in other words, when they've infected the host red blood cells, where clinical symptoms of the disease become evident. And then we're also looking for drugs that kill the so-called transmissible forms of the parasites. So these are the so-called gametocytes, which are taken up by a mosquito during the next blood meal, and then, of course, picks up those infectious parasites and then bites another person during the next blood meal. And of course, that's how malaria is transmitted. So it's looking for drugs whose mechanism of action or mode of action is such that it targets all the life cycle stages of the parasite, that we can offer chemoprotection, including killing what we call these hypnozoids or dormant forms of the parasites in the liver, for the malaria that is caused by Plasmodium vivax species, which often leads to relapses in malaria. So that's the full arsenal of drugs that we're looking for, which requires us to identify new molecular targets or new modes of action on which to base treatment strategies. MMV, Medicines for Malaria Venture, is an example of a private-public partnership. And this is where you bring together the private sector, exemplified by the innovative pharmaceutical industry. And I think the industry is not given as much credit as it deserves in areas like malaria, because there's a lot of effort that has come out of the innovative pharmaceutical companies. I just mentioned the work of Novartis, but there's also companies like GlaxoSmithKline, GSK, that have invested heavily in malaria research, and many other companies. Merck, I can list the name, that's endless. So that's what we're seeing, is not just contribution from the private sector, but also contribution from governments, and contributions from academic institutions. And to the question that you asked me, this is exactly how we have been able to meaningfully participate in contributing to the discovery of the next generation of malaria medicines. It's really this network of partnership model that is really, really kind of project managed by MMV, for example, as a product development partnership, bringing together academic institutions with industry and philanthropic organizations like the Bill and Melinda Gates Foundation, and also not just putting together this consortium, but also building a mentorship component, which is really critical for those of us who are in academic institutions where drug discovery has not historically been practiced in the way it's supposed to be practiced. So this model of networks of partnerships involving academia, industry, and PDPs like MMV with a mentorship component has been really critical to really see the impact of academic research being translated into products. And I think you see several academic institutions making very important contributions to discovering and developing the next generation of new malaria medicines. And I think it's a powerful model of how we can come together, not just to look to share benefits, but also to share risks that are involved in the discovery and development of new medicines. I think what COVID, with all the unfortunate consequence of the pandemic, but if I focus on what this unfortunate pandemic has done, and I focus on the positives of it, you can find positives even in difficult situations. One of them is what you alluded to, Raj, earlier, and that is a reminder of the importance of investing in research and development against infectious agents. If we neglect infectious agents in the field of tropical medicine, we also talk about neglected tropical diseases, okay? Whether it's Trypanosoma cruzi that causes American sleeping sickness, et cetera, et cetera. Those are neglected tropical diseases. But the coronaviruses are also neglected viruses. They've been around, but they've been neglected. So this is a powerful reminder of what can happen when you neglect a pathogen, when you neglect research into a particular area. So the positive thing about this is that it's reminded the world of the danger of infectious agents and the danger of neglecting anything, including malaria. Secondly, what COVID has done is provided a blueprint of how the world can come together, not only to share in the misery of the pandemic because we're all affected, but also to share in trying to find a solution. So what we've seen with COVID is unprecedented levels of cooperation internationally, be it governments or companies coming together to solve this problem. And of course, sharing data in real time, working with the regulators. In a way, now the bar has been set. So now it's even difficult now to tell people that, oh, drug discovery, takes a long time, vaccine discovery takes a long time. They'll say, hang on a second, but COVID, they cracked it in 10 months or whatever. That shows you it's possible. So for malaria, we bring this to malaria. First of all, we must remember this. There isn't just the impact of COVID-19 on malaria. There's the impact of malaria on COVID-19. And the danger of COVID and malaria in the community where malaria is prevalent is you can misdiagnose someone, because some of the symptoms of COVID and malaria are very similar. And that's a danger of this. So the health systems, need to be developed. And I think what COVID has also reminded us is of the importance of building locally. You need to build locally so you can respond to a pandemic, not just responding at the level of surveillance and epidemiology, etc., which of course is important. The world heard about this variant that was identified in South Africa. By the way, I don't like to call it the South African variant. That's wrong. It is just a variant 5 point, whatever it is, because people should actually appreciate that some country finds a variant, because you only have to look, you will find it. And we should be grateful when people find something and not start blocking them from traveling, because it's not solving anything. So that's what COVID has taught us, is also to build locally so that we can respond. And it's not just responding at the level of surveillance, and which is important, or genomics, but also it's providing the infrastructure that can contribute to finding vaccines, health innovation, and health systems. So building strong health systems, because even when you find a vaccine, we've seen this now, Raj, currently in Europe, across the world, It's one thing to innovate and find a vaccine. It's another for people to access that vaccine. And we've seen it with the manufacturing. It's not trivial. How are you going to meet the world demand for this? So it's reminded us of the levels of preparedness that are required to deal with a pandemic. And so these are the lessons that I hope all of us together, the scientists, the communities, the governments, and everybody together will take into the future. Where there are problems, where there are challenges, there are also opportunities. Malaria is not an African disease. It's not an Asian disease. It's a human disease. And a disease has no border. A disease doesn't respect. So when you get involved in malaria research, what you're doing is not just contributing to a specific problem. You are contributing to a human problem. Just like all of us, myself included, and yourself, Raj included, we have been beneficiaries of other people's sacrifices and innovations in whatever, the things that we enjoy. Somebody had to research and find a solution to something. So when you get involved in malaria, remember this, you're also giving something back to the community because you've also benefited from other people's innovations. And to remember also that, in fact, the worst that are affected by malaria in terms of a patient population is young children and infants. Children are the future. And this disease really kills children. A child dies of malaria every minute or two. And so when you're working on malaria, you realize what you're doing for the children who are helpless. And that in itself is a significant contribution. If you think about the economic impact of malaria, the loss in revenue, the devastation on economies, it's massive. Often we don't even think about the business cost of the disease. So working in malaria should really inspire you because you're dealing with one of the biggest killers of humanity in modern history, which has been around for a very, very long time. And so you'll be joining a community of innovators and of course, making a difference, and of course, picking up skills that you can transfer to another area.